I'd like to explain how we got here, and then I'm going to hand over to Claire to explain where we'd like to go next, hopefully with you. So I've started off really with a bit of a question in terms of, it's a question. My husband hates this, but I thought it was great. How do we actually get psychology in the map? I think probably most of us have sort of been aware that, again, like Sue said, we do a lot of things in isolation. We don't always have necessarily a national voice in terms of no sort of chief psychological officer. And we're quite a diverse group in terms of all the different professions. So how do we make sure that we can be included and we can contribute to some of those decision-making and influencing bodies, especially in this kind of new and ever-changing world? So this kind of started from an idea. How do we actually bring together psychological practitioners, all of us, not just clinical psychologists, I'm one, or cognitive behavioural therapists, or counsellors, or high-intensity therapists, or psychological wellbeing practitioners, or cognitive analytic therapists, or psychotherapists, or psychoanalytic psychotherapists, and so on. And how do we include our colleagues in terms of who provide psychological services, who are involved in the education and training of psychological practitioners, and our professional bodies? Don't necessarily want to replace any of these. We don't want to replace them. They all have their own roles. But how do we actually bring everyone together, and how can we actually strengthen our voice? Network seemed like a good idea. And I think this came out of a meeting that took place a couple of years ago where I think probably I was the person that sort of said, well, what are we going to do about it then? And people then said, well, what are you going to do about it, Gita? So you kind of, you ask the question, you get to do the work to some extent. And I think it's work that needs doing. So, moving on from that. Lost my slides. So why would we want to create a network? There are approximately 3,000 to 4,000 psychological practitioners in the Northwest. It's been slightly difficult to count us because we don't get coded terribly well. The Centre for Workforce Intelligence last year actually did some analysis and research and actually tried to put together a definition of psychological therapists, in part to try and help organisations actually categorise us as psychological therapists, as clinical psychologists, and so on. But if you ever look at workforce reports in trusts, sometimes we're not necessarily categorised as psychological practitioners. So there are approximately 3,000 to 4,000 of us, and we form all those groups, but it's still kind of unclear what proportions we are. But together, we can be a strong voice. Together, we could reach for the stars. Together, we could wear strange lipstick, perhaps, but you know, you don't have to. But what's important to all of us? I think there's something about promoting psychological well-being in our individual clinical practice, in the work we do perhaps with our colleagues. It's about delivering safe and effective psychological services. And I think that's been very challenging for many of us in terms of the cuts and the impact of trying to tighten our belts and deliver good services. What's also important is actually access to high quality education and training. How do we maintain our different workforces? How do we ensure that we develop? How do we get all that upskilling in terms of, you know, spreading the input we can in terms of working with our multi-professional colleagues? And I think, how do we improve our opportunities to share and learn from good practice and innovation? And I think for me, it resonated very much with what Sue said about allied health professionals, that my experience and perhaps my own behaviour is such as that maybe we don't share our good practice, maybe we don't shout it from the rooftops as well as we could. I don't think we're all like that. I think there's some people who are very good at that, but collectively, perhaps this is a network that could actually do that a little bit more. So, who are we all? And I know I'll miss someone out. So, psychotherapists, counsellors, arts therapists, and lots of others. Practitioner psychologists, clinical psychologists, health psychologists, so on, counselling psychologists, high-intensity therapists, psychological wellbeing practitioners, cognitive behavioural therapists. We're a pretty big group, and to a degree we probably all overlap to some extent in terms of what's important to us, in terms of how we offer our services, in terms of the fact that we are interested in sitting down with people and talking to them to enable them to improve their wellbeing and their lives. So, we put together a proposal, again, probably a couple of years ago, and took it to Neil McLaughlin, who listened very kindly and fortunately agreed with us, and agreed that, yeah, a network would be a very good idea, and also agreed that we really needed a workforce lead. And Clare Baguley's going to tell you all about that and is currently our workforce lead. Picture of a bit of scaffolding. I didn't know whether the London Eye was a relevant image, having just been there last week, but I thought, well, maybe health education could be the scaffolding, but we could take them into some of the pods as well. But maybe we won't go around in circles, but it does broaden our horizons. We have a much wider view up there if we actually get together as a network. Okay, so some of you will remember numerous discussions, extensive discussions about a name and what we should actually be called. I think we started off as an applied psychology and health and social care network about 18 months ago. Then we talked about an applied psychology network. It wasn't a title that was inclusive of all our professions and perhaps was more popular with some professions rather than others. So we came up with psychological practice in health and social care, and we came up with a psychological professions network. And we put out a survey. Some of you have seen it. Some of you, again, we're still evolving and emerging and trying to collect as many people to communicate with as possible. And some of you will have voted in terms of what you think the network should actually be called, which is why it's a psychological professions network. Okay. So that's the kind of timeline. The meeting where I said, what are we going to do now, took place not quite 2 years ago. This coincided with ongoing IAPT legacy planning, which involved IAPT colleagues, some of whom are in this room. We looked at doing that kind of workforce consultation with as many people as we could get hold of. So some of you will have seen those emails, some of you may not have done at that point. We had another event a year ago, almost a year ago to the day, where there was probably about 40 people in the room who said, yeah, it's a good idea, we should have a network. And a year later, we're in a room with 150 people who presumably think it's probably a good idea to have a network, or at least are willing to find out what it's all about. We established an interim steering group, which kind of was people that were prepared to say, yeah, okay, I'll help, I'll work through, and we couldn't have done it without them. As I said, we have engagement with Health Education Northwest. We had a network lead, workforce lead in Clare, and the steering group chair, who is me. And we got funding last summer, and as some of you will have seen, and hopefully most of you will have seen, you'll have been on our website. Between summer last year and December, I think Clare and I have done lots and lots and lots of work on the website, and I think realised all sorts of things that we didn't know before about website design and what we like and what we don't like. Photographs is an interesting thing. We had very interesting discussions about some of the photographs. So you may have your own opinions about the photographs, but we kind of picked them where we came. And also, it's not just our website. We've put together something as a starting point, but it's very much, this has got to be your input into this website as well. It's got to be for all of us. So, moving on from that, what's in a logo? We had lots of conversations about logos. I got very excited about this bit of the logo and realised that actually purple and which direction the logo goes in is extremely important, to the extent that we sat there, well I sat there, Clare didn't, and cut bits of people out to see how they'd actually go together better. So whether you like it or you don't, it has been described hopefully as people actually sharing and supporting each other in terms of putting their arms around each other. And I'd very much rather go for that. A colleague whose name I unfortunately can't remember, so I said, well, you could see them as punching each other, but let's not, please let's not go with that image at all. Okay, so, and it was purple, because purple seemed like a good idea. So any of you who've been on the website, and I do notice some subliminal hints of purple around the room, or less subliminal hints of purple around the room, so thank you. If it was random, I think that's great, we're obviously in synergy. If it's not random, you've made the effort, that's brilliant, and I have tried to go for purple. So I'm not sure whether this is a psychological professions colour, and whether I'm taking the metaphor of a purpleness too far. However, a logo was important, and a logo is where we've got to just now. It's now over to Clare to tell you where we're going next.
Okay. I think Gita's really nicely painted a picture of how we've ended up where we have, and I think that the thing that's been really, I suppose, enjoyable for me as well as enthusing is the level of creativity that we've been able to harness just in getting to the point where we've got a logo and a website. And I guess that whilst we're launching today. There is a lot of work that we've done to get to this point, but we very much see this as the start of the journey, really. This is really the place where we start looking to you as members and think about how can we make the network relevant to you. As Gita has explained, we think there's between about 3,000 and 4,000 members of the the psychological professions workforce when you put them all together. And they're a varied group with different skills, different expertise. The one thing that we do know is that the North West has a reputation for excellence and innovation, and it also has a reputation for making things happen in the face of chaos and uncertainty. And that's certainly a reputation that goes outside the region as well. So we're building on something very strong. I guess the way that I'm thinking about the next phase is to think about how we start to try to make the network as relevant to members, to people that potentially want to join us, and how we talk meaningfully to the stakeholders and the structures that Sue outlined through Health Education North West. So I quite like maps. I'm a bit of an orienteer and I like getting out on the moors. So I always sort of need to have a map somewhere in my head, and that's sort of the analogy that I'm applying to how we navigate the terrain that we're in at the moment. Jed explained that we're really we've been through quite unsettled times, and structures are working through now and starting to emerge, and what we need to find is a way of how we understand where we fit. There are a number of maps around. This might be one that you've seen. I quite like this one. This is the one that's produced by the King's Fund. I show it you because it's the King's Fund's map of how the new NHS has evolved. It's an animation, and there's a link to it on the website. It's quite useful to help you sort of think about, actually, if you feel like things are quite complicated on the ground and you don't really know where you'd have influence, that's a reality. That is how the NHS is kind of evolving at the moment. It's a busy place, and it's a place where new networks are emerging. However, I'm also a great believer that in that kind of chaos there's often opportunity. There are gaps in the system, and people are saying, how can we do things differently? How can we work more efficiently? What's the link between physical and mental health? So parity of esteem is being talked about. So there are opportunities for us at this time that are probably quite unique. A more useful map is probably to show you this diagram that is off NHS Choices. So it's a generic map that shows the NHS as concentric circles. Again, there's a lot in there, but the important bit, the very useful bit of it for me, is that it puts patients and communities at the centre. And I think that's one of the things that we really need to think about in developing the network and going forward. How do we remember that we're professions that exist and work for patients and communities and make our work relevant and sort of build on the expertise that we need to really make ourselves relevant to the other parts of the NHS that work with them. What you can see is NHS Health Education England sits where that blue arrow is. It's a kind of within the middle of the concentric circles. That's quite useful because what you can see is where the network also links into this map. So PPN Northwest is supported by Health Education Northwest. So by the very fact that we have that link, and with Centre for Professional Workforce Development, we have a route into the kind of stakeholders and the emerging structures regionally that we would really like to have the opportunity to influence and to showcase our work, talk about collaborations. So this will be the last diagram that I'll show you, not sort of overwhelm you, but hopefully the diagrams are getting a bit simpler. But this is our first kind of draft to show you about where the network would sit in relation to its influence and communication with Health Education Northwest, and importantly the Local Education and Training Board. They're kind of the same thing, they are the same thing, but the language around and how that around them is emerging as we speak. But those boards were very influential around, as Jed explained, workforce development, education and training, promoting clinical excellence, and really the future of the workforce in times where we're having to think about how can we work effectively and efficiently whilst putting patients at the centre of care. And I would like to put on that map as well how we look after psychological professions' well-being as well. I think how we still stay well, healthy and enthused in that context is also part of the business of the network. But you can see that we have the support of the Centre for Professional Workforce Development with this as well. And the 3 other networks have kind of been trailblazers, not just regionally, but nationally. So the networks are linked into national organisations. The health scientists, they've become quite a nationally known network. I think they've won awards because they've been trailblazers in taking their profession forward. And there's no other network like the Psychological Professions Network in the country either, nationally. So we've got an opportunity there to make links outside of the region if that is something that we want to take forward and is helpful for us developing our network regionally. But really we want to get our work focused on and think about where that takes us. So that's the map. The beauty of having a network, and myself and Gita, is that we're making it our job to try to understand what the terrain is and find a way of distilling it down so that it's understandable, so that you can work with us and we can also consult with you and help other people consult with you and be informed by your work and practice. So I guess there are 3 key kind of aims within the vision. If we have a vision around the network, it's to inform psychological professions workforce. How do we make sure that you get access to education, to information, to news, consultations, in order that you can be an informed, up-to-date profession with opinions that we can feed back into the system? How do we enable you to become leaders in your field, to take part in research, to innovate with the good ideas that you've got, to share good practice? And how do we help you influence decision making, influence thinking about the development of the workforce? We've started by working through the website. So that there is one of our photographs on the website that Gita has referred to. Can't tell you the trauma that we had around photographs. I don't know, maybe it's just sort of something about being sort of therapists in different shapes or forms, but it's like meaning of pictures. The pictures aren't ones that we're necessarily going to stay with. We're taking photographs today, and we want to start to personalise the website so it becomes more, more reflective of the Northwest. We're a bit concerned, we go a bit Americanised with the kind of presentation we've got at the moment. But people do look very enthusiastic and very shiny, which is what we would want to encourage. There's not a lot of purple going on there, so might need to work on that. So really, for informing, the website is probably our hub. We put energy into setting it up and thinking about the strands of it, and what we want to do is start working with you to populate that. So over the coming year, myself and Gita will be coming out to you, looking at what you want on that network, on that website, what else we can develop, and start to think about what links we can make to share and disseminate. We'll also be looking for local champions around different work areas, and we're particularly interested in looking at developing multidisciplinary working. So I guess that's one of the things that is a theme of the network, is that it isn't a single profession workforce, it's the together we're stronger kind of theme. So thinking about where we can innovate across the professions. We can also provide support to special interest groups, and I'll talk a little bit more about that in a moment. If you have a special interest group that is currently running and you want to publicise it and you want space on a website, we can offer that. We can also offer a web-based special interest group resource area. And at the moment, we've got our early adopters that are the PWPs, and they're bringing their newly developing psychological wellbeing practitioner professional network into the special interest group area. So over the coming months, hopefully we'll be able to showcase that as an example of how that might be used. but within it we have discussion boards, you can share resources, you can share news. So there's an opportunity there to bring in existing groups, get your group on our map by coming into the network and having your group recognised in the network. You're then on our map. That map is what we'll then go to start to think about how do we develop our governance structures. We'll be developing a board and refreshing our steering group over the next 6 months. And we'll be looking for representatives of the network, including professional groups and special interest groups, to come into that board structure. Secondly, we think about enabling, that third area. There are 4 strategic areas of interest. So how many of you have actually gone onto the website so far? Can I just see? Well, that's really good. Thank you. Have you all joined as members?
Thank you, sir.
Yeah. Through the afternoon, if there's any feedback about the website and things that you think we could do to improve, just let me know. And we need to gather those things. We've got 360 people signed up for it already, and it doesn't look like it's necessarily everybody that's here. So potentially we've already got about 400 people signed up as members, which is great. When you go into that, you'll see that what we're trying to do is help organise it in a way to help you think about how you navigate through these big issues that are coming through. And what you see is we've got 4 work areas, and these are the work areas that we want to think about with you this afternoon. And these work areas are very deliberately chosen because they strategically link into the language of health education Northwest and the larger drivers. But they're clinically relevant, so that's doubly good and really important. So we've got education and lifelong learning, supporting clinical excellence, research and innovation, and promoting psychological well-being. This afternoon after dinner, we'll have a look in more detail about what we mean by those. But I guess they're areas for us to develop and populate, bringing in your expertise, generating ideas, thinking about how through the network we might support innovation, taking those things forward. I've mentioned the special interest groups and working parties. Just to remind you of those, we've a small number at the moment, but we're looking to develop that. We can support new groups and we can support existing groups that we can just link to. You don't have to use this for anything other than to make it a link to resources that you have. This afternoon I'm going to have a board over there, that flip chart board is going to be a place for you to make a note of any groups that you might want to talk to us about bringing in with a contact name. So again, anything that you want to discuss or you've got an idea, make a note and we'll take it forward with you. Really quite excited about that. I think that's kind of an opportunity for people to take work forward around areas that maybe have been quite marginalised. So you can see there's been a lot of work going on. We've got a map. The map's emerging out of quite a complex NHS map, and it's our job really to simplify it for you but make it meaningful. But what we need now is for you to start to help us with it, to help us populate it, to see where our resources are. To get us to where we are, we've had an awful lot of support from a number of people, and I just wanted to mention them. There are a number of people that are in this room who have formed the steering group. I don't know, would you like to put up your hands, members of the steering group? Dotted around. You'll meet them this afternoon because they're all going to be facilitating discussion around the 4 work areas. But the steering group have been really important in supporting Gita and I in thinking about what steps we take, and I guess keeping us to task, giving us ideas, and getting us sort of thinking about what the vision is and sharing how we might communicate with that. There are a few people that we've used for the logo, which I really can't underestimate how much work that's got. M&M Designs, I want to mention them because they put a lot of work into the logo and helping us with developing stuff. And the web developers have been really, really helpful. So the website, Gita and I put stuff in, but people have put it together for us, you know, and we continue to be supported by them. So that's excellent. We've got PWP Special Interest Group I want to give a special thanks to, and Gareth, who will be probably very embarrassed, so I won't ask him to identify himself, but Gareth Stevenson has been working with us on making the special interest group facility work, and that will be the thing that we'll be using to roll out to yourselves. So thanks very much for that, and we're really looking forward to testing that with that group so that we can make it work as well as we can. And I'd like to mention Neil McLaughlin over here, sort of Neil, the man of many hats, who's seen psychological therapists through a very, very diverse and kind of rocky and challenging and interesting terrain, since graduate workers, through clinical psychology, into IAPT. And Neil, really, this network wouldn't have happened without Neil's support and continued support. And Barry Foley I wanted to mention as well, because Barry, where are you, Barry? Yeah. Barry, some of you know Barry. Barry has been our workforce lead within the IAP programme, and Barry's been a real stalwart in thinking about how can we legacy plan some of, all of the learning that we've had and bring it mainstream IAP, bring it into a network alongside the other professions. And then Vicky, Elaine and Lisa and the rest of the team who've got us to where we are today. There's been an awful lot of organisation support, so thanks very, very much. I know the day hasn't finished, but I did want to mention people, because I think in being excited about going forward, it's easy to forget where we've got to, and people are putting in an awful lot of work. So what next? Well, I guess there are two things, and this is where we start to hand over to you. We really need to make the network relevant. Gita and I are really enthused. We've got the vision. We're all there. We're wearing purple, and me a little bit more discreetly than Gita. But we're in there and ready. What we want to do is to share that vision with yourselves. The network is the sum of its members, so we really need to start to communicate that and make it relevant. And we want to use the four work areas, to get you thinking about those this afternoon, to think about how we can develop our work plan for the coming year and find out who we can link with, who wants to work with us. We're looking for people that are interested. So even if you're not actively doing anything at the moment, if you've got an idea or there's something that you'd like to help out with, let us know. That's what we want to develop. And then we've got to think about strategic development as well, and that's something we'll be taking forward with the board and the strategic, the steering group. And thinking about how we develop the website, linking to Health Education Northwest and our governance structures. So we'll be refreshing the steering group over the coming months, once we've got a fuller map and we know who's out there. And we'll be developing the board. So I anticipate that maybe in about 6 months' time, we'll have our board appointed and a refreshed steering group. So I'll leave you with that to think about. This afternoon we're thinking about populating that map. What ideas have you got? What resources do we have in the room? And who wants to be involved and contribute, maybe individually, but also as groups? And also thinking about how you take out the network, publicising the website, starting to use it, giving us feedback about it. Some very, very important things to be doing. So we end on the logo. I think that's it from me, really. I'm going to finish there because I feel like it's come to a natural conclusion.